Well, Ontario is banning consumption and treatment services sites within 200 meters of schools and childcare centers, which will lead to the closure of 10 facilities. For the details and reaction to today's announcement, let's go live to CP24's Melissa Duggan. Melissa, good evening.
Hi, Bakari. Good evening to you. And one of those locations that is set to close before March 31st, 2025 is the one behind me here, South Riverdale Community Health Center. So as you mentioned, 10 locations across the province now slated to close in the months ahead, 10 in all. There are 17 actually that are open in the province right now, but it's 10 that are located closely to schools and childcare centers that will be closing. We got some explanation for that move today from Ontario's Health Minister, Sylvia Jones. She's pointing to safety concerns around these supervised consumption sites, saying that there is a bump in reported crimes that happen around them, shootings, stabbings, assaults. Here's more of some of the explanation as to why the province is moving ahead with this decision.
We also know that the cycle of addiction is not being broken by using drug consumption sites. We need to do more to support a journey into treatment and recovery, to keep communities safe, and to address the tragic impact of substance abuse, drug overdoses, and opioid-related deaths have in our communities.
Now, in that same announcement coming from Minister Jones today, she also said that the province is going to be putting $378 million of funding towards 19 new hubs. They are going to be designed to help people with addiction issues, with homelessness, as these other sites are being removed from what they're offering right now. Now, we've been collecting reaction to this move all day today. Joining us live right now is Dr. Doris Grinspun, the CEO of the Registered Nurses Association of Ontario. Thanks for being with us today, Doctor. I wonder what your initial reaction was to this word from the province.
Thank you so much, and thank you for having us. I think the public needs to be very, very concerned on how the government is obscuring the truth. That's number one. It's not that they're moving these sites because they're close to schools, because if that were the case, they will allow them to reopen somewhere else. The province has decided not to allow any reopening or any opening of new safe consumption services. The province also is shutting down needle exchange, which happens at these centers, and the province is also putting a gag order for organizations, including municipalities, including public health units, that they cannot speak about this, they cannot advocate, they cannot speak even with the federal government about this. So what the province is doing is saying, we really don't care about these people that have substance use. We care only about people that are willing to take treatment. And the issue is this, as nurses we know very well, the same as not everybody smoking, or the same as not everybody drinking alcohol, which produces cancer, both of them, not everybody quits. Not everybody is ready to quit. The same with any other substance use. Therefore, what you will end up seeing is actually a huge increase in death. This is why we are saying it's a death sentence for people with substance use. And we also are saying it will cost taxpayers an arm and a leg in money. Why? Because you will have an increased rate of hepatitis C because of needle exchange that will not happen in the safe consumption sites. People that are in the streets, they don't have the means to have needles freely, so they will start to reuse the needles used from one another. You will see an increase on HIV. Let me tell you this, why I say it will cost an arm and a leg to taxpayers. HIV increase means the following. The drug of choice costs $1,800 a month, multiplied for 12 months, multiplied for 20, 30, 40 years that people will be using the drug. It will cost an arm and a leg, and it will not help the safety. If the minister or the premier, because this is the premier, this is not the minister, if they have said the places can reopen within a year in another location, we as nurses would have said nothing. they would have relocated and they would have continued to serve people and keep people alive and actually have a chance at treatment later on. This is not what they're saying. They already said no more. So basically, all you have is the few that will stay open. And in Toronto, you will start to see people laying down on the street, wasted in terms of toxic drugs, increased number of people dying, and an increased utilization of EMS that already they're very busy trying to keep people to emergency rooms. Emergency rooms increasing. They will be busy with people that otherwise could be saved, would not need this level of intervention. Do we support the investment in the hubs that the government is calling? Absolutely. This is what nurses were asking. We were asking, continue with safe consumption sites. In fact, expand them to all the locations in the province where they're needed. There are many locations. We have 4,000 deaths a year from toxic drugs. 4,000. That was in 2023. It will be more in 2024. And this is not the solution. What we need is in every location, safe consumption sites. We need the hubs, absolutely yes. And we need the hubs to support people that survive. You cannot support people that are dead. So what we are saying to the Premier now, and it's to the Premier, the 19 hubs that you are opening and allowing to open, all of them need to have safe consumption services, and all of them need to offer needle exchange. All of them, the 19.
Doctor, I think a lot of people who've been paying attention to this story as it's been unfolding today are thinking this is such a complex issue to be able to help people who have these addiction issues. I wonder, given your experience, what you have seen that's been effective, how people have been able to get the support, the help that they need.
So nurses, doctors, other people working in safe consumption sites have been able to save thousands of lives, thousands, because basically what you do is they're not using toxic drugs to start with. Some of them overdose on site. You prevent that. But the real issue now is actually the toxic drugs. And let me tell you, the drugs that are coming now from the US and other places that we see are even worse. You will see people with wounds in the street, and they will be in the street because that's the reality, and wounds that cannot be even cured. The reality 6 months to a year from now will be unbearable. So we are saying, Premier, rethink this. And it is the Premier, it's ideological, the issue. You want them not next to schools and next to kindergartens? Absolutely, absolutely. The 19 that are opening, they must have safe consumption services. They must have needle exchange, and they must have all the supports and the wraparound supports that are necessary.
Dr. Doris Grinspun, thank you so much for being with us tonight. We appreciate you sharing your perspective.
Thank you.
Bakari, I'm going to throw it back to you.
Okay, CP24's Melissa Duggan. Thanks, Melissa.